The National Taskforce for COVID-19 Prevention and Control on Wednesday issued an instruction calling on all members of the public to comply with virus control measures when attending funerals. The move comes after 9 of the 24 community-acquired cases recorded in Vientiane on Tuesday involved people who recently attended a funeral in Pak Se City, Champasak Province. The government is concerned about the rise in locally transmitted cases, fearing that more cases could trigger a wide-scale community outbreak. The task force said it was essential that everyone complied with all the recommended guidelines to slow the spread of the virus. At funerals, attendees should have their temperatures checked on entry, wear a face mask, and clean their hands with sanitizer. The coffin should be placed in a ventilated room, and the hosts and guests should stay at least 1 meter apart. The ceremony must be conducted simply, while the host must follow hygiene guidelines and spray the area with disinfectant. All guests must wash their hands regularly, particularly before and after eating food. All forms of gambling are prohibited. The venue should not be crowded, and the host must advise guests to follow all the virus control measures laid down by the COVID task force. The task force also recommended that guests should not share spoons, cups, or bowls while eating and should eat only cooked food. Funerals have reportedly been responsible for new virus clusters. A government official was among those who tested positive for COVID after attending the funeral in Pak Se. Laos is struggling to contain the spread of COVID-19 despite reinforced measures aimed at flattening the infection curve. In August alone, more than 8,700 new cases were recorded, along with 7 deaths. On Wednesday, 223 new cases were confirmed across the country, bringing the total number of COVID infections to 17,905. Of the new cases, 158 were locally transmitted. Champasak Province reported the highest number, 104, followed by Khamuon 17, Luang Prabang 12, Savaniket 11, Salavan 6, Vientiane 2, Bokeo 2, Luang Nam Ta 2, Vientiane Province 1, and Sekong 1. The 65 imported cases were reported in Vientiane 19, Champasak 9, Khamuon 4, Savaniket 27, Salavan 3, and Luang Prabang 3. Since the spike in locally transmitted cases, authorities in several provinces have intensified lockdown measures to prevent the virus from spreading. Members of the public have been urged to pursue a new normal way of life by regularly wearing face masks, using hand sanitizer, and taking other precautionary steps to stay safe.